I'm Tim from Coastal Physiotherapy. I'm one of the physiotherapists here. A question a lot of people ask me is about when they're going back to a gym, what they should be looking at doing. And what we often suggest, or something that's really important for ensuring you've got good integrity of ligaments, bones and muscles, is doing an endurance set. So that's doing 4 sets of 20 for around about 3 months. Can get a bit tedious, but it sets you up in the long term, so you're not going to get injuries later on down the track when you start increasing the load. So 4 sets of 20, you shouldn't be failing on any of those repetitions. You should just carry on and be nice and comfortable with them. Something else we can do before you go to the gym, before you start doing all that sort of stuff, is a musculoskeletal screen. So we can go through all the joints in your body and all the muscles and all that kind of stuff and make sure they're all working 100%. It's going to stop any injuries further down the track, and if we do find restrictions, then we can either start working on it straight away, or we can give you some homework to do before you start getting into the weights. So physios, we like to know about what you've injured in the past. It might have been 20 years ago, it might have been 2 years ago. But if you twisted your ankle, your left ankle 20 years ago, that might have changed how your left hip works. And that can have an effect on your lower back, which can have an effect on how your neck moves. So sometimes, your left ankle that you hurt 20 years ago might actually be giving you headaches now. That's why we might want to know what injuries you've had in the past. So these restrictions or these past injuries that might have caused some problems in your body, there's lots of ways of dealing with them. We can mobilise joints, we can release the muscle through soft tissue release, we can stick pins in them using acupuncture needles called dry needling. It doesn't really hurt as much as what you might think. If we find restrictions in your body, we can give you exercises to do, we can use soft tissue release to help loosen up the muscles around the joints. We can do joint mobilisation, make things go snap, crackle and pop. We can do lots of different things to help you get moving correctly again, and that's what it's all about, is having you move correctly before you start your exercise program.